Welcome, everyone. Good evening. Thank you for being here. This is the second town hall that my council office here in Seattle is hosting. Thanks to those of you who were with us last Thursday as well. We are trying to do this weekly because we know we need to connect with one another. We have to have political discussions. We have to develop an analysis of why the world, why we're seeing the crisis unfold in this way, how to address the immediate public health questions, but also the economic recession that we're going to be facing, how to get organized around concrete demands, and also how to build a struggle for a fundamentally different kind of society, as this one is clearly not working for the majority of us. So I really appreciate everybody who's tuned in. And also wanted to let you know that our next town hall, since we're trying to do this weekly, will be Thursday next week at the same time at 6 p.m. So save the date, and I will, in a few minutes after a couple of speakers, I will be sharing with you our a very, very important topic that we will be covering at next time's town hall. And it really is a call to action. It's not just discussion. Tonight, we have the great fortune of having frontline healthcare workers and essential workers with us. And after our panel is done speaking, we're also going to have a short period of public comment or public testimony. And those of you who are in Seattle and have organized with us and come to Seattle City Hall when we're having committee meetings or the city council meeting, when we're organizing around major issues and we have won major victories by getting organized. It's not going to be like that. It's because we're not all together in person. We are also still getting used to the technology here. So bear with us, and I apologize if those of you who want to speak don't have the time to speak. But just want to let you know that Ted Verdone, who is a policy analyst and community organizer in my office, will be managing the public comment when we get started there. And each of you will have a minute and a half. I know that's not going to be enough, but we want to hear some of your stories at the very least before we close for tonight. Globally, we've seen over 500,000 that are known to be infected by the coronavirus, and over 83,000 have died. And in the most desperate situation, and really heartrending stories of families and friends who've lost their loved ones and have been unable to say goodbye to their loved ones. This is indeed an enormous calamity that has befallen so many ordinary people throughout the world, and America is certainly not immune, has not been immune to it. We've seen the incredibly damaging consequences of not having socialized medicine and having the for-profit system encroach upon even the hard-fought public healthcare systems in Europe, and we've seen this globally, but we're especially seeing this unfold in the United States. And never has such a powerful case been made for Medicare for all as this pandemic has made. We've seen healthcare workers, doctors, nurses, technicians, assistants, and also hospital custodial, administrative, and cafeteria workers really, put their lives on the line. And and they've been recognized by other workers. But as healthcare workers have said, it's not enough for our society to thank them. We have to, as working people, we have to stand shoulder to shoulder with them, with the healthcare workers, with the frontline workers in their demands for personal protection, join them in demanding mass testing, and a real overhaul of the healthcare system so that lives are not needlessly lost. We also have to stand with healthcare workers who've been threatened with retaliation for being courageous whistleblowers. Right here in Washington state, we saw a doctor in a Bellingham hospital being just blatantly fired for raising important questions about the lack of protective equipment and the lack of life-saving equipment. All of this shows why we need to get organized, and it cannot be individual workers putting their own necks out, sticking their necks out there. We have to get organized as a working class, as a class. And the nurses unions are really demonstrating that from the front lines, not only on the front lines of saving lives, but on the front lines of workplace action in the middle of this pandemic. And we're so grateful to have Marty Harrison with us next, who will be speaking about both the situation that nurses and hospital staff are facing, but also why this is absolutely the correct moment to recognize the value of a union in the midst of the austerity and cuts that people are facing. Marty is a nurse with more than 20 years experience at the bedside in Philadelphia. She serves on her local union's executive board and is a member of Socialist Alternative. So she will be talking about all of these issues and also the need for socialism. Welcome, Marty.
Thank you, Shoma. Our healthcare system is broken, and it's difficult to articulate the degree to which it's failing to people outside the system, but I'm going to try. And this is failing despite the superhuman efforts of healthcare workers. I'm going to be talking a lot about nurses, but we're a team. We wouldn't get very far without our colleagues in respiratory, the lab, physical therapy, housekeeping, dietary, just like Shama was saying. But so I'm going to describe a little bit about our work in the hospital. And as nurses on a medical surgical floor, we do things for patients that they would do for themselves if they weren't sick. Feeding, bathing, toileting, repositioning, taking medications. But in the intensive care units, the ICUs, we do things for patients that their bodies would be doing for themselves if they weren't sick. Maintaining their open airway, monitoring the ventilators that are forcing the air in and out of their lungs, maintaining their heart rate and rhythm, their blood pressure, these very essential bodily functions that their bodies can't do for themselves right then. So when ICU nurses say that we can't take care of more than 1 or 2 patients safely, we are absolutely serious, and safe staffing is always our first priority. COVID-19 patients haven't peaked in Philadelphia yet. We're not quite seeing what New York is seeing, but we already don't have enough nurses. Because we didn't have the protective gear that we needed at the very beginning, nurses are getting sick, and all healthcare workers are getting sick and having to stay home. Hospitals in Philadelphia already are moving to 3 patient assignments. A patient on a 3 patient assignment last night in my hospital tried to light a cigarette and burned himself and his bed. He started a fire in his room because the nurses weren't able to keep close enough eye on him. But nurses in New York already have as many as 9 patients in the ICU. There was nurses in Michigan where a day shift had worked for 24 hours straight, 2 nurses, 26 patients on 10 ventilators. When the night shift came in, they were even shorter staffed, and the staff walked out and they were fired. So the disciplinary action is a real thing. We are doing our best, but we don't have enough of anything. We don't have enough space. There's 3 beds in every room that was built for 2. There's 2 beds in every room that was built for 1. We're running out of equipment and even medications now. And the hospitals are trying to stretch their ICU nurses by adding other healthcare workers and nurses from other specialties to create these pandemic teams. And my coworkers and others around the country are coming to the conclusion that we, as the frontline caregivers, must be making the decisions about which nurses go where and how the work is divided among us, because only we know what we can do safely and what we can't, and we need to be controlling our work. My husband asked me the other day if he or my children should get sick, what hospital should they go to? And I, of course, said my hospital. It's a safety net hospital. It serves some of the poorest zip codes in the country. And he was surprised that I didn't say one of the much wealthier hospitals in the city. But I said, it's true, we don't have the latest gadgets, but as union nurses, we have more power to draw our line in the sand and ensure that the staff has the right skills to take care of you. The well-endowed non-union hospitals are already pulling nurses outside of their specialties without the training and the skills they need, and they can't say no because they don't have a union, and it's just not safe. So patients absolutely need improved Medicare for all so they can get care that they need without worrying about the bills. As healthcare workers, we need control over our work and our institutions. We need massive structural change to the healthcare system to eliminate profit as the underlying driver of the system. And we need an organized public system that eliminates all this competition between governors, between hospital systems. We really need what Shama was talking about at the very beginning, a nationalized socialist healthcare system, so resources can be shared across the country to go where the needs are. If it's New York today, Philadelphia tomorrow. Frontline healthcare workers that are fighting for these changes are organizing a National Day of Action next Wednesday, April the 15th, and the link should come up on your screen to the event. So if you're a healthcare worker and you want to get involved, please reach out. There's a list on there of like actions that people have already taken, that healthcare workers have already taken. You can feel free to do one of those. You can try something else. Councilmember Sawant's office would like to support that work in Seattle, so please reach out. And over everything, healthcare workers, we need the rest of you to stay home. And that will mean essential workers in other industries taking control of their work in their workplaces, standing strong, standing together, and not being forced back to work before it's safe. Thanks.
Thank you so much, Marty. As Marty said, it's very hard for those of us who are not healthcare workers and not on the front lines of the COVID-19 crisis. It's hard to imagine how incredibly difficult this work is, especially considering the severe understaffing and the lack of critical equipment, of even protective gear. And we've had an incredible local speaker, Emily Barnes, with us at our previous town hall. We are happy to say that she's going to be speaking again today. She's going to be following Marty. She's a critical care registered nurse currently working with COVID-19 patients and a member of the Washington State Nurses Association who's speaking in personal capacity. And before Emily comes up, I just wanted to echo what Marty said, which is that, you know, at the end of the day, even in a hospital that does not have the latest gadgets, if you have a unionized workforce, it can make the difference between life and death for patients and also for the health of the healthcare workers themselves. And that is why it is so important that we all in Seattle really participate in the National Day of Action, April 15th, which has been organized by rank and file activists from the New York State Nurses Association, Michigan Nurses Association, and the Pennsylvania Association of Staff Nurses and Allied Professionals, which is Marty's union, SEIU, National Nurses United. Many unions have come together to organize this. We should absolutely, focus on this for April 15th. And I would urge other workers to also organize solidarity actions alongside healthcare workers. And as Marty said, the theme of this action is the system is broken. So if you're going to do social media about this event, please use hashtag the system is broken, all one word. And it's really important that we participate. Just examples of the actions that nurses have taken that we can emulate here is a social distancing rally and press conference after our shifts end, where we can place protest signs on the ground 6 feet apart and go one by one to the microphone. We've also had nurses throughout the nation organize car rallies or have press conferences holding the photographs of co-workers who've lost their lives to COVID-19 after not being provided the protective gear they needed, and they held signs saying, "We won't be your body bags." This is a really inspiring work, and to share more of such inspiring thoughts and also specifically about the Seattle situation and whether or not we should continue social distancing. This is a very important question. Again, it holds the key to life or death for our community. We have Emily Barnes sharing her thoughts.
Thank you, Kashama and Marty, for your comments thus far. It's great to hear from a nurse with as much experience as Marty has, especially from a different region and as a union executive. I've worked as a critical care registered nurse in the intensive care unit of a large community hospital for almost 10 years now. I've been a proud WSNA member for that time, and prior to working as a nurse, I was an SEIU member. I want to echo that working in a community hospital as a member of a strong union has definitely allowed us to band together as workers and advocate for patients, which we always consider part of our job as nurses, but especially during this pandemic, I think that it's very, very important and speaks to how important strong unions are in general. I've been working with COVID patients for about a month now. I actually took care of several of the first identified COVID patients in the nation. We had an outbreak at a skilled nursing facility here, and my hospital took care of many of those patients. It's really opened my eyes to how serious this disease is. I admit to being somewhat dismissive because I've taken care of patients during lots of flu seasons. Now that I've seen this disease at bedside, it can be devastating. Many of the treatments that we're trialing are shots in the dark to a degree. There is no cure for this disease, and we have no vaccine yet. The federal government and Centers for Disease Control were intentionally slow to acknowledge and respond to this growing threat. Trump called it a hoax and went so far as to acknowledge on record that he wanted to keep numbers low. I still see that being a strategy that the government is using. They, I believe today, just stopped federal funding for testing, which will continue to limit access to testing and obfuscate our ability to understand and monitor this epidemiologically. The CDC was actually pushed by healthcare professions to expand its restrictive testing guidelines, which is how at my hospital we were able
We seem to be having some problems with Emily's connection. We'll give it a
in
few
order to
seconds.
keep In order to keep ourselves, our colleagues, and our patients safe, nurses need to wear a gown, head and shoe coverings, an N95 masks and face shield, and change these between patients. Only this specific equipment, used exactly as we are trained to use it, can keep us from becoming walking vectors for the spread of the disease. These procedures must be followed exactly with the exact equipment that was designed for the job. Without this, we're only spreading the disease. Right now, we're supposed to change N95 masks between each patient, ideally. I get one N95 mask for my whole 12-hour shift. Most COVID patients should only be paired with one nurse each, and we need to ensure that increased staffing is maintained to proactively address this need. Every day that I go to work for my patients, I see the way hospitals try to save money by cutting staffing for the people who do the most essential work: nursing staff, housekeeping staff, maintenance staff, cleaning staff. Yet our labor is what stands between life and death for our patients. We're already seeing examples in the news of hospitals cutting pay for healthcare providers, firing healthcare providers for speaking out, and cutting staffing to unsafe levels, as Marty has also pointed out. Especially in my work in the intensive care unit, patient to nurse ratios are very important. We see the sickest of the sick, people clinging to life by a thread, and we're constantly managing multiple medications, complex medical devices, and machinery, and assessing patient condition and needs. We actively work with physicians at bedside to respond to acute decompensations, and we chart about all of it for 12 hours. Now we're having to incorporate scheduled video chats with family because they are not allowed to visit unless patients are actively dying. This is where the WSNA and other nursing unions come in. United in a union, us nurses can fight to protect our safety and to protect patients by limiting things like mandatory overtime and working longer than 16 hours in a row. We fight for legislation like the uninterrupted meal and rest break law that was just passed in Washington state. Without this fight, equations and profits are really the only thing driving healthcare decisions, and that's part of why our system is broken. At best, this is a tenuous and constant struggle, which nurses have been fighting for a long time, but then an event like COVID-19 highlights and exacerbates all of these issues. Our government's woefully inept and criminally negligent response to COVID-19 will only lead to millions more deaths. Because we don't have enough of the PPE, we need to protect ourselves. ICU beds, ventilators, nursing, medical, and ancillary staff. Because the federal government under Trump underfunds, silences, dismisses, and neglects the timely and aggressive response we need to prevent the healthcare crisis to come. As I've said before, as a nurse, I consider it my duty not only to care for patients, but to advocate for the community I serve. Patients have already been affected by the widening wealth gap, the housing crisis, and the debacle that is the American health insurance system. In our area, some of the legislation that Kashama's office have been working towards is taxing Amazon and some of the largest corporations in our area to help fund the economic to help fund solutions to the economic devastation that this is causing, and to help ensure housing for some of our most vulnerable citizens. If these demands aren't met, working people and the labor movement have to call for massive strike actions, including the possibility of building towards a general strike. I have to say that as a public employee and a nurse, I'm ethically and professionally not able to strike, but I would support those who did. Lastly, as someone working on the front lines, I'm asking that people continue to stay home for the community, and so that I can return to my home to my family safely every night. I've seen firsthand how devastating and isolating this disease can be. Please help your community members, loved ones, friends, and family live through this pandemic without having to die alone in a hospital bed with only me or one of my colleagues at their side. The peak of this disease in our region, some of the new models have indicated that it's already passed, but I'm questioning that as a nurse working at bedside. Social distancing does seem to be working in the Seattle area to help slow the spread of COVID-19. We need to maintain it for at least 9 to 18 months at this point, until we have a vaccine, until we have effective treatments. The government and corporations are going to continue pushing to end these social distancing measures, and we have to fight back. I regularly tell patients and families in the ICU that this journey is a marathon, not a sprint. And that's especially true in my workplace now and in the global community. We need to remember that we're in this for the long haul for the sake of our community. We need to fight back against government and corporations, shifting the conversation to valuing the economy and profits over people's lives. We have to remember to be consistent, but also take care of ourselves and our loved ones by passing the baton to others with greater resources when we're worn out. We have to fight for our most vulnerable. And thank you for allowing me to speak. I really want to reiterate that we're in this for the long haul. It's going to be at least 9 to 18 months. And it's very important that we maintain social distancing for that time and support workers with what they'll need to continue surviving. Thank you for having me.
Thank you so much, Emily. And as healthcare workers are like Emily and Marty are telling us, social distancing is absolutely crucial. And I think the working class movement in the Seattle region has a special role to play right now, because according to public health scientists, it seems that social distancing and the early mitigation, the early steps taken towards that social distancing and stay-at-home policies has actually been having a positive effect in limiting the spread of this virus. But that is precisely why, the scientific logic tells us that we should continue for the foreseeable future. You heard it here. Emily Barnes said we have to continue this for many, many months. But it's going to be that itself is going to be a political struggle. It's going to take a political fight against the bosses of the capitalist class, because as long as most of us stay home and don't go to work, they don't get to maximize their profits. So there will be the constant pressure on us to go back to work. And it is not just going to be Donald Trump who says, let's send the workers back at the end of April. It is going to be both Republican and Democratic establishment politicians, and it's going to be the corporate bosses throughout the region as well. We all heard how Boeing executives who themselves, used billions of dollars of our taxpayer money, which comes from us working class, to do stock buybacks for themselves, they had made the disastrous decision that their mechanics should go back to work yesterday. And it was only because of sheer community pressure, including from my office, that they were forced to rescind that decision. But we're going to see more and more of that pressure. And that's why I really think, what Emily said is very important, that we have to, part of getting organized is also to push for safety and for our lives, because the bosses, their thirst and greed for profits is so huge that they will literally let us die in the workplace if they had their say. That's why we have to fight back. And our next speaker, Algier Hawkins, who's a surgical technician from NYP Cornell Hospital in New York City, has a long experience of building such struggles led by the working class. And one of the reasons we're really happy to have Algier here is because we need to share notes, not just within the Seattle region, but across states. And a voice from New York State is extremely important right now, because as the New York Times said, today there's a tragedy unfolding in New York State, but also in specific pockets of New York City. And the reality of the COVID-19 crisis combined with capitalism completely belies this whole myth that it affects rich and poor equally. It doesn't. It's because of the underlying conditions of capitalism, where communities of color, immigrants facing deportation, working class and poor communities are set up in such a way that it's affecting them the hardest. And Algier is going to share some of those thoughts, and also why he's a socialist as a healthcare worker and as a working class person in New York City. Welcome, Algier.
Thank you. Thank you for having me. Certainly, New York State and city is the epicenter of the crisis. Some of the statistics show that we are over 150,000 positive cases of the coronavirus. And when you hear news of 799 dead within 24 hours or 824 dead throughout just New York City alone, we have numbers that have now surpassed the horrific events of 9/11, 2001. It is absolutely a fact that when you hear Governor Cuomo speak, who is now the new darling of the corporate elite, corporate media, compare that to certainly the press conferences of the idiot in chief, Donald Trump. He stands out. But what doesn't come together in the real reality is that the lack of resources, the lack of PPE, the lack of beds, the lack of hospitals is a reality that has led this pandemic to be even more horrific, because for the past 20 years, throughout the state and in the city alone, we've had major cuts to healthcare. For example, since 2000, we've lost 21 hospitals. Since 2003, we've lost 15 hospitals in New York City. We had about 73,000 beds in 2000. Today, in 2020, we have 53,000 beds. That's a 20,000 bed loss. And with the loss of those beds, it's the loss of staff, it's the loss of resources, it's the loss of ventilators, it's a loss of ancillary staff that at this historic moment could have been needed, could be used to really confront the virus in a more serious way, in a more systematic way. And so we're seeing the dangerous cocktail, particularly in New York, of the over 20 years of austerity, certainly the environmental crisis that we are faced with on a daily basis, but also the concrete lack of resources for the working class, the poor, and the most oppressed of our society in New York. Certainly has already been raised about Medicare for all. But I would even go further to say that particularly in the state that has lost so much resources, have lost so many hospitals, that the idea of the construction of clinics and hospitals are absolutely vital, actually. For the ruling elite, they may not think it's a profitable venture to build hospitals and clinics in every community, in every corner of the state and city. But we're seeing now the cost of the lack of those institutions, those buildings that would provide the proper services and care for the COVID-19 patients and for the broader working class. Certainly, what we've seen, probably the most explosive numbers have taken place in Queens, New York. Over 7,000 cases of the coronavirus. Queens, like New York, is a global city. Queens is a global borough. In fact, it's enclave, particularly in Elmhurst and Jackson Heights, where you have those of Latin American descent, Asian descent, Southeast Asian descent. Many of them are undocumented immigrants. Many of them are working class. It's a powerful enclave of ethnic culture and family, just totally ravaged by this virus, which only compounded the fact that the deep levels of poverty that existed, now with mass unemployment, the lack of health care, of housing, and now hunger, where you have families who are out of work, have to literally ration their meals for the day, eating once a day. This is in the most prosperous city, in one of the most prosperous cities in the world. It's a global city. And then you had Mayor de Blasio say that no one in our city will go hungry. Well, once again, that's a full blatant lie, because they are going hungry. And in fact, they just won't die from this virus, but in fact, they will probably die from hunger as well. Every corner of New York State and city have been touched by the virus, from prisoners in Rikers Island to people who live in public housing with NYCHA, MTA workers, the frontline workers, nurses. I work. This past week, I began working more closely with COVID-19 patients as a person, just helping to lift and turn the patients so they can be changed, so they be taken care of, could be wiped down. And so to see that up close has been a humbling experience, certainly. And which brings me to the fact that these questions, these pertinent questions that have been put upon us by this virus, poses for me why, I'm a socialist. I've been a socialist for 25 years, since I was 21 years old. And that seeing the workers who are on the front lines of fighting back against this virus, fighting for the greater need of PPE and ventilators and more space and more beds, say to me that we live in a system that is sick. Actually, it's a criminal system. Particularly when you hear that the intel was there, that this tsunami of this virus was upon us going back to October, in fact. And as the sister said correctly, that Trump called it a hoax, took the numbers and played with the numbers, and in fact has led to more death and destruction. And so this society, as we're living through this moment right now, it's a failed society, it's a failed state. And you add that to the economic depression that we're living through right now, along with this pandemic, says to me that we need a system change, that the ideas of socialism, despite Bernie dropping out of the campaign, dropping his campaign, that these ideas are not going to go away, that working people will want a change, want a systematic change to what has been an utter crisis, unmanageable. To stop here, right now we're living through multiple 9/11s. Every state will have their own 9/11. And I think only a change of our viewpoint, our perspectives, our society will begin to address all the things that we need of food, shelter, and dignity.
That viewpoint from New York City and from a socialist is really greatly appreciated. And alongside healthcare workers, we also have essential workers, workers who are not in healthcare, but nonetheless providing essential services for our community, especially the 70% of the workforce of America, which is now under stay-at-home orders. And among those essential workers are delivery workers, cargo handlers. And so our next speaker is Matt Smith, who's a cargo handler for Amazon at the Kent Delivery Station. And he's spoken at our town halls before. And today he's specifically also going to address the question of retaliation that workers are facing. You know, we've heard from healthcare workers facing retaliation, but essential workers like delivery workers, like grocery workers are also facing retaliation and even potential firing for blowing the whistle on the fact that their employers who make massive profits now because their businesses are still running even despite the pandemic because they're providing essential services, are refusing to provide them even basic protections, let alone the real things that these workers need in addition to protection, which is hazard pay, free childcare, and paid sick leave, so that they can go home and recover if they're feeling sick, and that can be addressed by having adequate staffing. And so, as we get Matt ready to speak, I also wanted to share that, this is happening not just in the Seattle area, but around the nation. Many of you might have heard that a warehouse worker named Chris Smalls was fired from the Amazon warehouse on Staten Island simply for saying that that the warehouse needs to be shut down for a deep cleaning, for professional cleaning, because he and his co-workers were starting to face, recurrent sickness, and more and more workers showing symptoms of COVID-19. And the workers, because they had a deaf ear from the bosses, they organized a walkout. And the next thing you know, this worker, one of the leaders of the walkout, was fired. We're seeing workers like Matt here also face similar retaliation and potential retaliation. And that is why it's so important for us to hear from people like Matt and to know, to understand how we can stand with them and make sure that we push back against the bosses who are retaliating against workers simply for speaking the truth. Go ahead, Matt.
Hi, thank you, Shama. So my name is Matt Smith. I work as a contracted cargo handler at an Amazon delivery station in Kent, Washington. That's right outside of Seattle. And a little over a week ago, the Seattle Times reported that down at a warehouse just down the street in Kent, there was a warehouse worker there who tested positive for coronavirus, for COVID-19. And I say that the Seattle Times reported this because Amazon management and my contractor have still not told us that anyone has tested positive at our warehouse or any other warehouse in the Seattle area. And we're facing a dire situation now at Amazon, where there are now over 50 warehouses where workers have tested positive for COVID-19. And it's the same story everywhere, where the company is not telling its employees about it. They're still not taking basic steps to protect our health, despite repeated demands and repeated requests by workers. We still don't have hand sanitizer. We still don't have masks. We still don't have additional paid sick leave for workers who might be experiencing symptoms of coronavirus. They've, as Shama mentioned, they've refused to shut down facilities for cleaning where cases of COVID-19 have been confirmed. And they're still refusing to stop shipping non-essential items despite stay-at-home orders and the shuttering of other non-essential businesses. And Amazon can't claim ignorance here. They can't claim that they didn't see this virus coming, because for months, while they weren't taking basic steps to protect our health, they were taking steps to protect their profits. So back at the beginning of February, all the way back in the first week of February, Jeff Bezos pulled out $3.4 billion from his Amazon stocks in anticipation of this virus spreading, in anticipation of stock market declines. And in that same week, Business Insider reported that Amazon was stockpiling inventory in its warehouses in anticipation of supply chain disruptions due to coronavirus. And not only that, as I mentioned, Amazon workers have been sounding the alarm on this stuff for weeks. We've had petitions going around for over a month asking for basic things like paid sick leave. And so Amazon has been well aware of what's been going on and what's needed to protect workers. So this is ultimately what happens under capitalism. Is huge companies like Amazon, they put profits over workers, they put profits before public health, they put profits before everything. And not only that, they are retaliating, as Shama mentioned, they're retaliating against workers who are speaking out. So over a month ago, when it was clear that Amazon wasn't taking the steps that were needed to protect our health at my warehouse, I started getting organized. There was no other choice. They weren't doing what was necessary. I started getting organized with my coworkers, having meetings outside of work, drawing up a petition with the things that we needed to change. When my manager found out about it, rather than fixing the problems, he called me into his office and he blatantly threatened me. He brought me in. He said that he heard I had been talking with my coworkers. He heard I had been organizing meetings, and that it, quote, will not be tolerated. And this is a pattern. This isn't an isolated incident. This is the system that we live in, where rather than protecting workers, big business attacks workers who speak out and demand protection. And this happened in New York too, right? So Chris Smalls, this organizer at a warehouse in Staten Island, after weeks of him and other workers requesting basic health protections and being ignored, one of the warehouse employees there tested positive for COVID-19. So warehouse workers there took the courageous and at this point, frankly, necessary step of going on strike to demand that Amazon shut down that facility for a thorough cleaning. And not only did Amazon refuse to take that basic step of cleaning that facility, they fired Chris, who again was one of the main organizers of that walkout. And as Chris said in an interview that he did with Councilmember Sawant, I think less than a week ago, this was a clear attempt by Amazon at retaliation. And not only that, but to intimidate the rest of the workers at that warehouse, as Chris put it, to, quote, cut off the head of the snake. And this is what big business does. They will continue to try to intimidate us. They will continue to try to retaliate against workers who speak out. But here's what we know. If we give into that intimidation, things will only get worse. They will continue to threaten our health. They will continue to disrespect us. And they will continue to work us, me and my coworkers, all of us, into the ground for the sake of their profits. The only way forward here then, we know that that's the case. The only way forward is for us to organize and for us to fight, as multiple people have already said. And this is already happening. So in addition to Staten Island, Amazon warehouse workers in Detroit and Chicago have staged walkouts. And just 3 days ago, the workers on Staten Island correctly stood in defiance of Amazon after their retaliation. And they staged a second walkout at that facility, demanding many of the same things. But this isn't just Amazon workers. So Instacart workers as well launched a national strike to protest similar conditions. Other examples of workers fighting back have been mentioned in other industries. This is happening all over, where workers are facing these same conditions, where companies are putting profits above the needs of the workers and the community. And it's important to recognize that these fights are not isolated from each other. We have to take steps consciously to connect these fights, to connect these struggles into a single unitary common fight. An important example of this, I'm really happy that after I speak, there's going to be someone speaking, a tech worker who has been working with other tech workers to speak up against Amazon's retaliation and in favor of warehouse workers' demands. And I won't go in, because someone else is speaking on it, I won't go too much into the details here, but I do think it's an important example of connecting up these fights. And if you're a tech worker on this call, I encourage you to get involved. They're launching a social media action in the next few days under the hashtag Tech Solidarity. So please listen to the details of that going forward and get involved. But we need to take these kinds of things further. We need to connect these fights in deeper ways. Ultimately, we need our own political party where we can come together as workers. We can organize these things. We can use that organization to wage these fights together. And that includes fighting ultimately to take these huge companies like Amazon into democratic public ownership, so that working people can make all of these decisions on the basis of public need, not profit. We can make sure that workers like me, my coworkers, are getting basic health supplies. We can make sure that we have paid sick leave. We can make sure that we're actually delivering what is essential, and making sure that we're doing everything necessary to stop the spread of this virus. But this goes much beyond just Amazon workers. We as a community need to get together, and we need to take steps to build the fight against these companies. I know this has been mentioned. The Tax Amazon fight in Seattle is a huge step towards doing this, towards taking on the power of these huge companies that run all of our lives. I know we've introduced legislation with the help of Councilmember Shama Sawant into the City Council in Seattle that would put a $500 million tax on the biggest businesses in Seattle, like Amazon, who are profiting off of this crisis to fund immediate relief for working people from this crisis. And we need the city councilors to act on this. And in order for that to happen, we know that they're not going to do it on their own. We need a mass movement of people to demand it. We need people to stand up, get organized, and make sure that they're taking on the power of big business and getting organized to make sure that that happens, so that we can wage even bigger fights in the months, in the years ahead, and we can take on this whole system. Thanks.
Those of you who are watching the live stream, if you are in solidarity with Matt Smith and other workers who are facing potential retaliation and even firing, please post comments on the feed and also email our council office. My staff will share the email address for our office, because workers who are on the front lines of this kind of struggle, where they're taking on their bosses, need our support. Whether or not you work at Amazon, we all should stand in solidarity with Matt. And as he said, also, please get involved in our struggle to tax Amazon. And as he said correctly, all of these struggles are unified. So the struggles in the workplaces are also joined together with any potential success we can win for the Amazon tax. And we cannot trust politicians. We've seen the Democratic establishment betray us over and over again. We saw our hard-fought Amazon tax that we won in 2018 be repealed through backroom deals by so-called progressive council members. And that is why we're going to have to build our own independent grassroots struggle led by workers and for workers. And similarly, we need a party also that is run by workers and for workers, and represents the working class as a whole, not the interests of the bosses. And our next speaker, Sam Kern, is going to be an example of the kind of unifying of struggles that Matt was talking about, where tech workers, warehouse and delivery workers, grocery store workers, we all need to come together and understand that our struggles are common, even though the specific issues we face in our workplaces might be slightly different. Sam is a UX engineer at Google, who's calling in tonight on her personal capacity. She is first and foremost a climate scientist, and she will share with her her thoughts about tech workers organizing in solidarity for striking Amazon warehouse workers and delivery drivers. Welcome, Sam.
Hey, Shama, thank you for the introduction. I would love to be able to call myself a climate scientist. I'm a climate activist, first and foremost, and I first really started getting involved in labor organizing through attempting to win greater, stronger climate policies across tech. And this is something that I really believe in. And through working on this, I've come to realize how critical it is that we build a strong grassroots labor movement, because while our coworkers are being mistreated and endangered in this case, those are exactly the kinds of protections that we need to win for our workers that will allow us to build stronger momentum into the climate fight. So as soon as COVID-19 started ramping up, my fellow tech workers and I have been looking for ways that we could get involved. And it's just completely sickening to see the way that Whole Foods workers, Instacart workers, Amazon warehouse workers, delivery drivers are being treated by our employers. And so Whole Foods is a subsidiary of Amazon. And an email came out about a month ago where Amazon upper management was encouraging their workers to donate their sick time to their coworkers who were experiencing life-threatening medical conditions or who had a recent death in the family. And it's just the most heartless thing I can think of. And I am very fortunate to have had my own work not be greatly impacted by COVID-19, but it's so hard sitting here knowing how many people are being affected and just feeling so powerless to help. And while there are a lot of mutual aid projects that are spinning up that I encourage you to look into, and Amazon warehouse workers have a GoFundMe, and there are countless petitions and organizations that I would really encourage you to look into and give your time to, and Socialist Alternative is one such organization. I also want to call attention to a particular action that a few tech workers are running next week. So starting on Monday, we're going to be posting photos in solidarity to demonstrate solidarity with the striking workers. And I think that there is a lot of skepticism, especially among like white collar tech workers, that employee activism is at all effective, that, you know, posting a photo is worth their time. But speaking from personal experience, I've been in some situations at my company where I was feeling a little bit mistreated, feeling like I wanted to speak up about something and not feeling like I had a strong support network. And what has always made so much of a difference in those situations is my fellow tech workers coming to me and saying, "What you're doing is important. Thank you for speaking up. I'm with you." And so showing that support network, it might not feel like much, especially because we individually are only one component of that large support network, but it's absolutely vital. So hopefully there is a link being shared around in the chat right now. That link, bit.ly/amzn-solidarity, that has the instructions form for participating in the action. And it should hopefully only take 30 to 45 minutes. We're just asking you to write a sign with a message of support for the striking workers. And if you don't feel comfortable, or if your employer will not allow you to appear, like even in your personal capacity, in close relation to like a personal political statement, then you can always just chop your face off, show off your moose, and that's totally fine. Really, just anything is so wonderful and so helpful. So, yeah, please share this with your fellow workers across tech. And we're trying to get to 100 commitments by Monday. I think we're hovering around 40 or 50, and every single person just helps so much. So yeah, thank you very much.
Thank you, Sam. And I meant to call you climate activist, not climate scientist. Thanks for catching that slip. But we need both scientists and we need a lot more activists, because ultimately the question of addressing the climate catastrophe, just like the question of addressing workplace justice, is a question of political struggle, and how successful we will be in organizing ourselves as a working class movement ultimately is going to be the one single component that will decide whether we can move towards changing the society or not. And that's why it's important that tech workers are organizing. Tech workers can and need to be a vital part of worker organizing. Please be in touch with my office to get connected with Sam and other tech workers. And if you have tech workers in your family and friend network who you think will get activated and get politically organized, then please connect us with them, because we need to really bring workers together who are willing to take part in these kinds of actions, where no one worker is out on the front lines and going to be targeted. But if we're together, then we're stronger. Our next speaker represents another section of the workforce which is also on the front lines right now and is greatly affected, and are speaking up, and we need to stand with them as well, and also hear about the conditions that they're facing. We have Jim Sanders, who's a bus driver in King County, and it's really important that we have Jim with us tonight, because we've seen public transit drivers having faced massive dangers, and they continue to face those massive dangers despite the fact that they have told the public or private entities that employ them that they need protective gear right now, and they needed them a month or 2 months ago, and they're faced incredible loss of life. And that's why it's important to hear from workers like Jim. But before Jim goes on, I just wanted to share with everybody who's watching our next town hall, which, as I said, is on Thursday next week at 6 p.m. Algier mentioned, the healthcare worker from New York mentioned, we're facing an economic recession that might look much more like a depression. And already we are seeing the signs of it. We are seeing this massive unemployment, which economists are predicting will go up to 30% in the second quarter, which is depression level unemployment. We also saw the Wall Street Journal report today that a third of the renters throughout the nation did not pay their rent in April. And that's happening because, obviously, given that most American workers live paycheck to paycheck, if you don't get a paycheck in a month, then you are basically destitute, let alone being able to pay your rent. And so I think inevitably we are going to have to organize as renters, but also bring it together working class and middle class homeowners. And that's why a couple of weeks ago, my office launched a petition to, demanding that the state governor, Governor Inslee, enact a suspension of rent, mortgage, and utility payments, and also bring about a rent freeze, meaning no rent increases for the rest of this year. And that petition has become really successful with over 8,200 signatures. And we've seen a nationwide petition also, which has gained now 3 million signatures. So clearly, working class people are crying out and saying, look, we are out of jobs. We don't have paychecks. We can't pay our rent. We don't even have money for groceries. And so, in real life, people are in a situation where they may have just enough money to buy groceries and medicines, but not enough for rent. And we absolutely should reject any kind of situation and any society that forces people to make a choice between paying rent to their corporate landlords versus buying food for their family. And that is why it's so important that we get organized as renters and also homeowners who are going to face the prospect of foreclosure because they can't make their mortgage payments. The governor, who's part of the political establishment here, the Democratic establishment, not surprisingly, unfortunately, has done nothing despite tens of thousands of people in the state demanding a rent and mortgage payment suspension. That is why May 1st is a very important date for us. Between now and May 1st, we need to get organized. There is a call from many renters, working people, and activists to organize a rent strike for May 1st. But a rent strike is not somebody taking a courageous and adventurous position on their own, or one or a few renters refusing to pay rent and facing the consequences from their landlord and being powerless to to deal with them and potentially becoming homeless, or one or a few renters being unable to pay rent. That's not what we mean by a rent strike. A rent strike is something similar to a workplace strike action where renters, just like workers, will need to get together with their fellow renters, whether it's in the same building or renters from your workplace or your family and friends network, have meetings, online meetings, to discuss a political strategy, to empower ourselves with those political strategies and ideas, plan together, and then go on strike together, strike with unity against the bosses. And this is extremely important. Organizing for a rent strike is extremely important because we're going to go up against some powerful entities. It's going to be the rapacious corporate landlord industry. We're going to go up against the whole of real estate, the big banks, the mortgage holders, basically the billionaire class. So this is not going to be easy, but this needs to be done because, come May 1st, many more of us are not going to be able to pay our rent. So please contact my office if you would like to help organize this rent strike, because we need to be very serious about this, and join us next Thursday. I hope hundreds will join us next Thursday because we have some serious organizing to do. And on that note, I wanted to invite our next speaker, Jim Sanders, who's a public transit driver in King County.
Thank you, Shama. I'm fortunate enough at the moment to be able to observe the stay-at-home order without loss of pay. As of Monday, my bus route's been canceled, but I've been driving the first 2 weeks of the stay-at-home order in the ramping up to the stay-at-home order as well. And while there were some significant early safety measures taken for bus drivers, such as mandating riders board the buses from the back unless there's an ADA, halting fare enforcement and fare collection, which was one due in no small part to community activisms and Councilmember Sawant's office. There were gloves and sanitizers handed out to operators before they go out to their buses. So there were a few things, but unfortunately, all of my union sisters and brothers who are still working right now, and there are still over 100 routes still operating at the transit authority I work for. None of them have N95 masks yet. Obviously, that's not unique to transit workers. But I think we would all agree that any frontline worker, any essential worker that has to go to work during this pandemic should have the proper protective equipment. And even though some of those early measures were taken, it wasn't enough to prevent the death of Scott Ryan, who was a transit worker from Snohomish County and one of the first, if not the first transit worker to die from COVID-19 in the country. So the reality that transit workers are facing right now across the country is incredibly scary. We're driving 40-foot, 60-foot pitches, and to think of walking into a petri dish without proper protective equipment, it sounds crazy. And many of us have heard what a delay in acquiring equipment, in changing the service schedule, in changing operation procedures can do. We've heard the horror stories in places like Detroit and New York. LG already spoke about New York, but just an additional fact, there was a story I read this morning that said New York transit workers are dying at triple the rate of first responders. And I think that just underscores the reality that even though in King County there were some very good early measures taken, there's been a very uneven response by transit authorities across the country from state to state and even city to city. It's hard to believe that there are still transit authorities in this country who are not sanitizing their buses on a regular basis. There's still authorities who are not mandating rear entry, and let alone talking about hazard pay. There's been no talk of that here in any real way, and there are some from that point to talk about what we would really need to be continuing to work during a pandemic. So I think transit workers in these conditions need to be prepared to act collectively until safety is properly addressed. Bus drivers in Detroit set a pretty heroic example. In mid-March, they declared, we're not going to work without safety protections. And in less than 24 hours, they shut down the bus service in Detroit. And in less than 24 hours, all of their demands were met. I think it's a really good sign that the leadership of the Amalgamated Transit Union and Transit Workers Union have really thrown down the gauntlet, telling transit agencies, you must provide for transit worker safety or we will take aggressive action, effective until demands for safety are met. Of course, this will need to be backed up with concrete organizing and concrete action. So we'll see, but I do think it's an important development. But I think we should also remember, all frontline workers, not just transit workers, and on all workers in general, none of the underlying fractures in our society are just going to magically go away unless working people get organized. We'll still need to fully fund and dramatically expand mass transit even after this long, hard period of living pandemic is past. And we're still going to need to improve transit worker safety after this crisis is passed for crises that are bound to come in the future. We can do all those things now. We can tax big businesses like Amazon to expand and fully fund mass transit, to build tens of thousands of units of affordable social housing, high quality social housing. We can also, all small things we can do while social distancing. I don't know if it'll be available on this call, but there is a petition that started from the president of ATU Local 1005 in Minneapolis, Ryan Timlin, that is calling on all workers to support essential workers getting effective PPE immediately. So getting, signing that, getting involved in a way that, getting connected to other people and getting organized it's essential now. And you also get involved with the Tax Amazon campaign as well. So I really appreciate being asked to be on this call, and solidarity with everyone.
Solidarity with you, Jim, and all your co-workers. And as you said, union organizing and worker organizing does work, and we can win victories, but we have a long way to go. And tonight we've heard from healthcare workers, other essential workers, and we're going towards public comment before closing the night out. But to round off our panel, we are going to hear from another healthcare worker from Seattle who brings an important voice from the hospitals. We have Ruth Jones, who's a certified medical assistant in an outpatient women's clinic for Kaiser Permanente, caring primarily for pregnant women. Ruth has also been an activist for several years in the Seattle area, fighting for the Amazon tax and other workplace issues as well. So please join me in welcoming Ruth.
Thanks, Shama, and thanks to everyone else who has spoken and told their story so far of what them and their coworkers are experiencing. Working in an outpatient clinic, we face a lot of the same struggles that our sisters and brothers in hospitals face: lack of PPE, lack of proper staffing. So for an example from my experience, as Shama said, I work mainly in a prenatal clinic, so I'm not seeing actively sick patients for the most part. But I have one N95 mask that I was told to only wear it if I really need it. And I don't know if I need another one. We are using disposable procedure masks that are supposed to be one-time use. Right now we're using them for a week at a time. And most people in my clinic work 5 days a week, 40 hours a week. So on top of this, the in-person appointments that we are still seeing, we're having a lot of patients do phone visits and telehealth. But the people who we are seeing are the people who have the most urgent and critical needs. So in addition to the stress of a global pandemic, just the needs of our patient population who are into the clinic are much higher than they would be on a typical clinic day when there's more of a mix. Like other folks have mentioned, there's been no mention of hazard pay, and this is of course a really common story in healthcare. I haven't talked to a single healthcare worker who isn't experiencing the exact same thing and the exact same challenges. Communication and clarity around what protections to take for ourselves has been really poor and really unclear and constantly changing. And it differs from hospital to hospital in the area. And I think this really highlights the benefit of a strong Medicare for All system. One set of standards, one set of protocol, all healthcare providers are going to be getting the same information about how to protect ourselves. And like a lot of folks have said, what will it take to get the things we need in healthcare, the staffing, the PPE, the hazard pay? It's going to take action. It's going to take workers standing together. And like other folks have mentioned, it's going to take a lot of people staying home, and it's going to take, fighting against the boss's greed and their need to continue profit, because like other healthcare workers have said, you know, what we need now is for people who can stay home to stay home so that we can take care of the people who can't stay home and take care of ourselves. Folks have mentioned the economic crisis that has come along with this public health crisis. Many of my patients who have been about they've been laid off. Most of them are expecting parents, a lot of them for the first time. They've not only been laid off, they're now faced with losing their health insurance. And so we're seeing the coronavirus amplify things that have been problems for a long, long time. Our healthcare system, the fact that access to healthcare is tied to employment, health disparities. We've seen in cities like Chicago, where the rate of people of African Americans dying is just astronomically higher than the white population there. COVID complications. So all of these things are just exploding, but they were already there, and they will still be there after COVID, unless we get organized now and demand, you know, a fundamentally different society. We needed the Amazon tax here in Seattle before COVID, and we need it much more urgently now. Such a tax could help the thousands who've been laid off stay afloat. It could provide hazard pay for frontline workers like myself and the other folks on this call. And most importantly, it can be an ongoing resource, because we know that the fallout from this and the housing crisis that Seattle was experiencing before the pandemic is going to be even worse afterwards. And this can give us an ongoing resource for building tens of thousands of units of affordable housing that's needed more now more than ever. I really want to thank everyone who's been on this call. You're all heroes, and I hope everyone stays healthy. Thanks.
Thank you, Annalie. And I think you brought an important voice of us, you know, our sisters and brothers who are going to have children and have just lost their jobs, their paycheck, and on top of that, their health insurance. I think that's such a poignant case for socialized medicine, because what an inhumane situation to put a family into. So obviously, all the workers who have shared their thoughts tonight, they have highlighted both what a long road we have to go towards, in terms of building our struggle, but also hopefully left you all with a feeling of empowerment that this can be done. Our last item for the agenda tonight is, as I mentioned, public testimony, which is a minute and a half for each of you. Ted Verdone from my office will share the number to call right now. Please make sure you call that number. And I know it's not going to be straightforward, because this is all, this is a new world. We're doing this online. We're not able to see, get your names, the traditional way, but I hope it still works. And I hope we're able to fit in as many of you as possible, but obviously we don't have unlimited time. But make sure, if you're not able to speak, and even if you're able to speak, join us in the struggle and write to my office so that we can connect with you and continue to build our struggle. And don't forget, Thursday next week, 6 p.m., we're going to be talking about how to organize for a rent strike.
So my name is Ted Verdone. I'm a policy analyst in Councilmember Shama Sawant's office. As she said, the numbers on the screen, and we're testing out a new system. If you would like to speak, you call the number. It'll ask you to enter your meeting ID. You put that in. You hit pound. It'll ask you for your participant number, or just hit pound. You just hit pound again, and when that happens, your phone number will show up at a list. It will tell you that you're muted, and I will be able to unmute you when it's your turn to speak, and then after your minute and a half, I'll mute you. If you're watching on almost, I think, any of the live streaming services that we're streaming to right now, you will have a 30-second delay. So you will definitely want to mute your audio. If you are Otherwise, you will not be able to speak. It won't be, it won't work. So hopefully this system works, and we will our first speaker is now unmuted.
Yes, this is John with a question for the healthcare participants, and I really salute your bravery and the work that you're doing day in and day out. How do you think we need to get our unions to play a more proactive role in fighting not just for what you need during this crisis, but also for the systematic change that we need in the healthcare system? And I'll go offline to hear the answer.
And while we're testing out the call-in feature, it would be good if somebody felt free to answer the questions right away.
Hi, this is Marty. As Emily mentioned in her contribution, it's very difficult sometimes for healthcare workers to strike, because when we strike, frankly, patients die. And so it's obviously it's not within the legal framework, the way the unions have been boxed into very, very narrow like ways of acting. But the best possible thing for other unions to do would to be strike for us, so that or take action, take workplace action when we, just for the safety of our patients, can't do that. Many workers occupy much more strategic positions in the capitalist economy, they can shut the bosses down very, very effectively. Logistics workers in Amazon, UPS, across that that industry. You saw how strong that flight attendants were, the way they were able to sort of end the government shutdown. So that strategic position in the capitalist economy plays such a role in how powerful the workers in that industry are. So work together with us in concerted action that can go beyond just the four walls of your workplace or even of your industry, so that we're working together. And when when we're in need, you're there. When you're in need, we're there. And it's not just that an injury for one is an injury for all, but then on the flip side, all those victories for one become victories for all, and the movement can get stronger with every victory.
So thank you for helping us test out the public comment feature. If you are one of the people that were watching on YouTube or Facebook or Twitch and attempted to call in and had trouble or found this system difficult, please email us and let us know. But it appears like this system of public comment works. There seems to be no reason why the Seattle City Council cannot have public comment at all of its meetings. We now have this option, so at future town halls, you can be prepared for the opportunity to speak in public comment when it is on the agenda. So I will bring down this screen now and turn it back over to Councilmember Sawant.
Thank you, Ted. And as Ted said, we are still testing this out, but he also is right. Our council office has tested the public comment before the city council establishment has. And I agree with him that there's no reason why they cannot provide public comment immediately. There is technology to accomplish it. And I apologize that we weren't able to share the number and the process for how to call in advance. We'll make sure we rectify that in the upcoming town halls and make sure that people are ready to, ready with the knowledge of how to do that. And I also appreciate the community member who called and for Marty to respond. I wanted to thank all our speakers once again, both in the Seattle area and our speakers who joined us from the East Coast. This was really a tremendous example of workers who are sharing the stories of their own workplace experience and of how to build struggle on the front lines. We have a lot of work to do, as all the speakers have highlighted. I hope everybody stays healthy and safe tonight and in the coming days. Make sure you're maintaining social distancing if it's possible. Our best wishes to all the essential and frontline workers. We're going to be on your side, fighting alongside you. And make sure you join us next Thursday, how to organize for a rent strike and make May 1st a day of actions. Good night.